The type of treatment given for lung cancer depends primarily on two factors: the type of tumor and the stage of the disease. Although there are many subdivisions within each category, most lung cancers are divided into small cell lung cancers, almost always caused by smoking, and non-small cell lung cancer that has numerous potential causes, including exposure to asbestos. The stage of cancer refers to how far advanced the cancer has gotten. By determining the stage or the progression of the disease, the doctor can determine available treatment techniques as well as probable survival rates. The cancer is first categorized using the TNM system, in which the doctor evaluates the tumor size, whether the nodes are affected, and whether the cancer has metastasized. Each item is further subdivided according to the severity of the cancer. For example, a tumor smaller than 3 centimeters in diameter and located in the lung is identified as a T1 tumor. By contrast, if the tumor is larger than 3 centimeters in diameter and located in the lung, it is identified as a T2 tumor. The same type of analysis is applied to the lymph nodes, where there are 4 categories. Metastasis simpler. It can't be determined. It exists or doesn't exist. After the TNM categories are identified, the doctor can then give the cancer a stage 1 through 4 rating. The more progressed the cancer has gotten, the higher the stage rating. Stage 1 cancer is a relatively small tumor with no involvement of the lymph nodes and no metastasis. Stage 4 cancer is cancer that has metastasized. Treatment for stage 1 cancer will frequently involve surgery since the cancer has not grown large and has not gotten into the lymph nodes. Part of a lung or even an entire lung may be removed to try to get the cancer out before it progresses any further. Several clinical trials are still in progress to determine whether follow-up treatment with radiation or chemotherapy increase the long-term survival rate, currently 30 to 50% for people with cancer caught in this stage. In patients whose medical condition does not allow surgery, radiation is an alternative curative option. Stage 2 cancer has moved into the pulmonary hilar or bronchial lymph nodes, but has not spread beyond the lungs or a tumor that is more extensive, but with no lymph nodes involved. Doctors remove as much infected tissue as possible and follow up treatment with chemotherapy, radiation, or both. In stage 3 cancer, the tumor has invaded structures in the chest and/or lymph nodes in the mediastinum, but has not yet fully spread through the body. Treatment is much the same as with any stage 2 cancer, but surgery may no longer help some patients where the cancer has spread out or has moved into areas like the lining of the heart that are not safely operated on or near. In some cases, surgery may follow radiation and chemotherapy, or doctors may recommend preventative radiation therapy to the brain. Stage 4 cancer has metastasized. It is spread outside the chest cavity and can be anywhere, the liver or even the brain. Stage 4 cancer is treated with multiple drug chemotherapy to try to kill the cancer at any cost. Combinations of therapies, including surgery, in addition to radiation of the brain, work in some circumstances. At this stage, a primary goal is often to treat the symptoms as much as the disease. Most people, 70 to 90% in stage 4 lung cancer, require significant pain relief. Radiotherapy and even massage and other relaxation techniques help people deal with pain issues associated with stage 4 cancer. For some people, oxygen helps ease labored breathing and shortness of breath. And in other cases, surgery or radiation to remove tumors pressing against the trachea help deal with these issues. Some pain and difficulty in breathing is caused from an accumulation of fluid in the linings of the lungs. When the fluid is removed, the pain eases and breathing becomes more manageable. Another frustrating symptom of advanced lung cancer can be paralysis of the vocal cords. This can lead to changes in a person's voice or an inability to speak at all, but worse, can cause a person to choke on their own vocal cords. An injection into the area that makes the vocal cords thicker can prevent them from falling backwards into the throat, causing the person to choke. On July 5, 2007, Medical News Today reported findings that men and women react differently to chemotherapy drugs used in treating advanced lung cancer. Women over the age of 60 have a much higher survival rate than men with the same degree of cancer involvement. Under the age of 60, the sex differences seem to largely disappear. The scientists are hypothesizing that estrogen plays a role in the change. If it can be identified and quantified, it may open new treatment options for both men and women. While clinical trials offer no guarantees, they do offer the patient hope. They also give the knowledge that even when the worst happens and the person does not survive the cancer, that person has still contributed to research that will hopefully cure cancer someday. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.